and then probably most of your questions are going to be for Cora, so I'll turn it back over to Cora now.
Okay, yeah, so I'm happy to take any questions, and just want to note that this is really difficult to have a kind of a personal conversation about a specific issue with a specific child. So I did try to keep my presentation broad, and I'd appreciate you trying to ask as broad a questions as possible that might be applicable to many families. But if you do have specific questions that you want to follow up with me about, please email them along to Lindsay, and she will pass them to me, and I'm happy to talk with you in a little bit more detail.
Just a reminder too, if anybody doesn't want to, like say any questions out loud for any reason, you can message them to me just by clicking on my name in the participant menu, and then I can read them out loud, and Cora can answer them.
Hi, this is C1, and
Hi.
I actually have a question for Dr. Chung.
Sure, go ahead.
Yes, so going back to your presentation, one thing that surprised me, and I'd like to hear what your thoughts are, if it seems surprising to you too, is that less than half of the individuals were diagnosed with ASD. And I guess to me that's surprising, and I'm just curious what your thoughts are.
Right. So I have to admit I haven't met all 12 individuals with this, so I can't tell you based on my own personal evaluation whether or not they may have had features, some features of ASD that maybe not met diagnostic criteria. So, and at least for what we've done so far, we haven't, not just is it that I haven't seen that, but we haven't brought them in and had one of my colleagues see everyone. So all of the data, I'll just put in the caveat, are parents reporting this information to us. When we can, we've reviewed records to go with this, but primarily this is parents reporting this information. The other thing I'll say is a limitation is that some of the kids are still little, so some of them are still on the younger side, and I don't know well enough whether or not some of these may, evolve and blossom. But I'm not entirely surprised. I mean, even I'll say in a broader way for beyond HIV, EP2, even the genes that are genes that we think of, I think of as being very classical autism genes. It's not 100% of individuals that have changes in those genes have autism. They may have some features, some shared features of autism, but they may not, if we go by very strict sort of definitions of what autism is, they may not meet all of those features. So I'm not surprised. I mean, the number I usually carry in my head for HIV EP2 is it's about 50-50 in terms of the percentage of kiddos that have autism. But I'd say even for those that don't have the official diagnosis, as I said, they still have some features that overlap. And so that may be part of what you're thinking is, or not, I'm not sure. But I do think everyone's got at least some features that overlap. And I don't know, okay. Cora, you also have some experience, Cora. You may want to comment as well in terms of some of the genetic forms of autism that you see in clinic.
Well, I think Dr. Chung summarized it quite well, but we know that these are risk associated with autism, but I think what we find with some of these genes that even though that there is higher risk, it's not 100%, although with many of the forms, we might see what we would call sub-threshold signs or symptoms. We might see things that are ASD-like, but it's just not quite to that criteria to meet a formal behavioral diagnosis for autism.
Hi, this is Jenny. I have a question for Cora.
Yes.
We just recently started my daughter on some medicine for some of her behavior issues, and wondering how often you see some of these medicines working well. So mostly kind of for some aggression and impulsivity, she started on guanfacine. So I know a lot of times it's kind of a trial and error on what medicines work and how much work and that kind of thing. So I was just kind of wondering your input on how often you see them work or how often you need to change them, that kind of thing.
Yeah, you're right. And I'll let Dr. Chung weigh on this too in terms of the medication aspect. From my side, as somebody who doesn't prescribe the medication, but who sees children put off medication for behavior issues, and we try to use those things working together, I do see a number of kids doing quite well. We have to pay attention to what are we targeting. So if the medication, like guanfacine might be targeting some inattention or hyperactivity type symptoms, then we might not see that work as well for something like aggression, right? So we have to think about what exactly do we expect this medication to improve. And we might need to go through and do quite a bit of trial and error. Unfortunately, there really seems to be no crystal ball. We don't have a great way of predicting what medications are going to be helpful, but I have seen many medications be very helpful, especially if we have a child who's very hyperactive or very inattentive. Sometimes it kind of stacks the deck in our favor a little bit, that we can really help our interventions that we're doing be a little bit more effective because we have a little bit of power there. But yeah, I have seen them be very effective with many kids, but often it is trial and error, and we do have to try to different medications and at different dosages, and it can be a very slow process. But it's also important to recognize what symptom do we exactly want to target with this, and make sure we keep that in mind when you're thinking about whether or not it's effective. Dr. Chung, do you want to add anything to that?
Yeah, I would just say this is actually one of the things that I hope we're going to learn from each other. And I would actually throw this out to the other parents who are on the call if they're willing to say it, is that I hope we do get enough experience jointly. I do think even in HIV EP2, I do think there are going to be some differences from one child to another, so I can't guarantee that what works for one child with HIV EP2 is going to work for all. But I do think, and I have seen it certainly for other genetic neurodevelopmental conditions, that there are some medications that tend to work better and some medications that tend not to work as well. I personally, at this point, don't have any experience with guanfacine in HIV EP2, so I can't give you any personal experience in terms of whether or not it's likely to work. But I just want to underscore what Cora said, is that you do have to give it some time and don't give up just because you tried it a week and you're not seeing any differences yet.
Okay.
This is Jenny again. Sorry. Do you have what, Dr. Chung? You said you don't have experience with guanfacine. Do you have, like, if we're not finding that the guanfacine is working, can we go back? It's the developmental pediatrician that we're working with on this. Do you have other recommendations that would that you're finding is working with HIV EP2 that are maybe a little bit better?
So we can go back, and I'm certainly happy to, and we can take it offline. We don't have a lot. I don't know if you remember, and we'll post these slides again. We only had 3 individuals who had really tried any medications whatsoever, either to deal with sleep or behavioral issues. So we didn't have a ton of experience. And at this point, as I said, and one of the things I'll offer to do, by the way, is if you all as a group want to sort of ask questions of each other and get group feedback on this from all the families that are in Simon's VIP, we can relatively easily facilitate this and get answers, relatively quickly about this because it's a small community. So like I said, if people don't feel comfortable speaking up tonight or other things, we can sort of put it out, or you guys can talk amongst yourselves on Facebook. But I think you're going to get even more detailed sort of rich data from us talking openly, or maybe even not talking openly, but sharing amongst the people in the group even more so than what I have here. Because like I said, we only had data on 3 people, and I haven't talked through the 3 of you who've had these experiences to get in depth in terms of knowing what worked and what you had to do and what didn't work and all sorts of other details. You know what I mean? So I don't want to mislead you. I think we should just have sort of more detailed discussions in the community if you guys feel comfortable doing it.
Okay, yeah, that sounds good. I did kind of throw the question out there to the Facebook group already and got a little bit of feedback. So we kind of have talked about it. So
Okay, good.
thanks.
So hi, this is Meenal. I had a question for Wendy or the neurologist. Um, I saw in the beginning the slides you had where you say that the therapies are the way to go. Like you had physical therapy, occupational therapy, speech. So how do we explain this to our doctors here? Because even though he has the diagnosis, it's like I'm advocating his need, whereas how do we explain it to the therapist or the, I don't know how to put it, like how do we get more services?
Yeah. So, I mean, I'd say, and Sid, I don't know if you're still on the line, but you're more than welcome to chime in. I mean, what I usually say is that every child needs a champion, you know, a real advocate who understands the condition and is willing to, you know, write. Unfortunately, they oftentimes, a lot of letters of medical necessity, sometimes actually, you know, being at IEP meetings or phoning into IEP meetings or other things, but someone who's really going to advocate for the child. From my point of view, I try and use the fact that we know something about this to be able to say that we know, we have experience, we know that eventually this pays off and that it works and that it's not easy and you can't give up. And as we're doing this, you know, when we can show that there have been successes for perhaps whatever we've done in prior therapies, to be able to point to those successes and really demonstrate how efficacious it's been. So it's not easy, but I do think you need to, I mean, I hate to say this, but most times I would say 90% of times it works just in terms of working with, by writing letters, by talking with the therapist, by talking with the care coordinators. And very occasionally I'll end up with a parent who needs to take some more aggressive legal action when they've got, you know, oftentimes very expensive out-of-district therapies that are needed or educational programs that are needed. So depending on how aggressive you need to be, and I'm not saying, you know, that most people, again, need to retain legal counsel to be able to do this, but you got to fight for your child, and, you know, folks like us, that's what we do, is try and help you with that. And so anyone else on the call, feel free to add in.
This is Sid over here, and just to echo that sentiment, what has been helpful is sometimes having a physician, whether that's a neurologist or a developmental pediatrician, be there at the IEP meeting. You know, they don't have to be there the whole time, but be there in presence. I think that makes an impact, and that actually can, you know, in my experience is that's actually made a difference in cases where we've been advocating for services and the school system has been, you know, they're limited by resources, but seeing a physician there, school administrators have made a comment, well, we've never had a neurologist or physician come to an IEP meeting before, and it really kind of makes a difference. So, I mean, not to say that's going to guarantee you'll get the services you need, but that's the kind of advocacy I think that sometimes may be necessary to go forward.
Okay, thank you.
I have a question. This is John Ford for Dr. Chung. I was curious if there was any correlation between particular phenotypes or behaviors exhibited with mutations within particular domains of the HIVEP2 protein.
Yeah. So far, and Sid, you can comment if you've seen anything differently. I haven't, but I'm not surprised by that in the sense that, as I said, with save that one missense variant, everything else is, I think, with nonsense-mediated decay is essentially just haploinsufficient. So I apologize about all the jargon, but you know, just to give you a quick answer, I don't think missense variants may matter by domain, but probably only missense variants. The rest of it, I don't think you end up with a short truncated protein that has some sort of gain of function or other alternative mechanism, if that makes sense.
Yeah.
So hi, this is Meenal again, and I had a question for the geneticist or Wendy. So So they have now these kids have a diagnosis of HIVEP2. Is there more genetic studies that they need to go through to identify some other genes, or I mean, I just don't know.
Yeah, I mean, I'll give my advice, and certainly any of the other providers on the phone can chime in as well. So I think most of the children that I've seen have, number one, gotten their diagnosis. Everyone I know of has gotten their diagnosis from exome sequencing. And I think as in the laboratory, when we do exome sequencing, we take a very comprehensive view of things. And I think many of us have experience to know that there are some children, as unusual as it may seem, that actually have two independent genetic diagnoses, and we actually analyze the data even looking for that. And it is a very comprehensive study, and I feel very confident that, you know, at least in the children that we have so far in HIV-EP2 in this study, that explains really all of their symptoms. Like I said, I have in rare occasions had children with two diagnoses. None of the ones that are in the data sets that we talked about strike me as being so far outside the range of what we've seen that they need to have a second diagnosis, but that data would have been included within the exome sequencing. So the bottom line is, I don't think any of your children need to have additional genetic testing. I think you can stop looking for the answer. I think you've probably found the right club to be a member of with this. But if there, you know, if there should be something that just feels differently and doesn't feel like what we've been talking about tonight that you're noticing, certainly bring it up with your doctor. I don't know all of your children personally, and so I can't say that I can say that every single detail of what symptoms they might be having are part of this. But the general feeling that I have from certainly all the patients that were in our publication and the ones that I've seen data from feel to me like they're similar and they're not outside the range of what we've been seeing. So anyway, others want to weigh in.
All right, thank you.
So this is Wendy again. I know it's getting late. We're glad to take questions, but we also wanted to save time for the families to talk to each other. So I'm going to put out one last call to see if there are any last burning questions, and then I'll just close with a couple comments.
Okay, I think I have one more question. This is C1 again. So my question is I'm not sure if I'm using the right terminology, but the good pair of the gene that's still good. Do we have any understanding on, in any individual, I'm not sure how I'm asking this correctly, but how possibly one individual, that good pair actually is working harder versus another individual where theirs is just doing the normal amount? I'm not sure if you understand my question,
No.
if that's clear.
Right. No, so I understand your question. So we have ways of reading this out, either, and I apologize if I'm using some technical terms, but we can measure the amount of at the gene level, the amount of signal that's coming out of that gene, either because of something that we call the RNA or the amount of the protein. So yes, there are ways of actually seeing how quantitatively, how much of this is produced, and like you said, how much that gene or how hard that gene is working. So there are ways of assaying it. Just as an example, and I'll get back to why we've asked you or given you the opportunity to contribute samples, is that there are people who will try making cells in a dish, so brain cells in a dish, and adding different medicines to that dish and seeing, can they change the amount of the protein that's produced, the amount of HIV-EP2 protein that's produced? Is there any way of sort of dialing up the amount of protein, getting it closer to the right amount, the right level of doing it, and seeing if there's a medication that might be, or another chemical that might be well tolerated that would have that effect. And so that's what people think about doing in terms of strategies to try and develop treatment. So your idea, your original idea is actually a good one, and there is potentially a path forward to do those types of things. Okay, so I think what we'll do is I'm just going to, number one, I want to thank everyone who took the time both to prepare for tonight, especially Lindsay, Jennifer. You guys did a fabulous job. You're amazing. And for all the families, all the providers, I hope the families realize you've got a great set of cheerleaders out here that, just we love you guys, and we'll do what we can in terms of being able to get you information and provide you with anything we can from the scientific or the medical point of view. We're going to, again, give us a few days. We'll end up having this posted online so that other families can come back and look at the slides, look at the information, share it with friends, families, other families that are diagnosed down the road. And if you have feedback, we really sincerely appreciate any feedback. This was an experiment, and I think, personally, I think it went very well, but I think there are other things that we can always do better. So please give us feedback about, what you liked, what you didn't like, what we could do differently. If you'd like to do something like this in the future, what topics you'd like to cover, we'd love to hear information about that.